All right, well,
Oh,
hello.
all
Welcome
right.
back to my sister Keeper-Cle. I am so honored to have my dear friend, Nicole Berry, who is a dual certified family nurse practitioner and also certified in psych as a nurse practitioner as well. I have read to you her bio several times. She's like family here now with my sister's keeper, so I will not go over her bio again. So she's been so welcomed here in our community. So it was definitely my pleasure to have her back. And we're excited because she is definitely more than family now because we're excited that she's going to be joining our team as part of health and wellness, where we're going to give her, because as you see, we've been having her as part of my sister circle for the last couple months because this has been a definitely much needed topic. So it
Mhm.
was definitely something that we need to do to have her come aboard once a month. So she'll now be sharing with us starting next month, once a month on Wednesdays. So you won't have to
Yes.
worry about not having Nicole here and not being able to have your concerns addressed. So it is my pleasure to hand it over to Nicole and look forward to seeing her as a um, part of what we do here once a month on Wednesdays.
Absolutely. Again, I thank you to my sister's keeper for the offer. And of course, I would love accept it because I love to do this because like you said, this is a much needed topic, especially during this time of racial tension as well as the COVID. So we're stuck in the house. We don't know what to do. So I think this is perfect timing. God's timing is always the best timing. So I want to talk about grief, but not grief. So I really wanted to start talking about the underbelly of why people are not getting the help that they need, right, for mental health. Um, so 1 in 5 people have a mental illness. I didn't say diagnoses because a lot of people don't go get diagnosed, but 1 in 5 people have mental health and the symptoms are there. I'm going to raise my hand as being one who had been diagnosed with depression and anxiety. And we have to break that stigma, okay? Mine was related, like I told you before, due to loss of a child, but nonetheless, I still have had a diagnosis. 1 in 24 has a serious mental health. That's dealing with your schizophrenia, schizoaffective disorders, bipolar disorders with psychosis presenting, and psychosis. So 1 in 24. Now, let us not forget about those stigmas that's out there as to why people are not getting the help that they need. Okay, so why are we not getting the help that we need? Everybody in all races, why are we not? We're looking at these stigmas, public stigma. Whatever society has said or taught us or want us to believe about mental health, that's what we view as law, I would imagine, to some people, right? So the second stigma is self-stigma. That's when we are internalizing these things. We're believing what society has to say about mental health. And it doesn't have to be true. They can just say anything. They don't do proper research. Anybody could say anything about mental health without doing the proper research. We have the perceived stigma where when we internalize it, then we start seeing it, oh yeah, well, now I see it as this way, and it is a bad thing, and I don't want to deal with it. So we go put it under the rug, right? And then that's when that label avoidance come in. People do not want to be labeled as nothing, okay? Um, I diagnose a lot of people, they want to just hear depression, but I'm like, it's a step further. You may have bipolar, you may have schizoaffective. I got what? Especially people of color. They don't want to hear nothing beyond they are diagnosed with depression, okay? And some of them stick with me and some of them leave, and then they come back saying that they really do have that diagnosis and wanted a treatment for it, which I always praise them for coming back and getting the treatment. Then we have the label avoidance. We talked about that. Then the stigma by association. I always think about my mother regarding this. because her side of the family, my maternal side of the family, is diagnosed with schizophrenia heavily. And my grandmother was as well. And my mother would tell me some of the things she had done. And my undergrad is in psychology, got my bachelor's in psychology. So when I figured it out, I say, Ma, grandma has schizophrenia. She's like, she did not have schizophrenia. She just had a mental breakdown. I'm like, oh, okay. So, and I never brought it back up to her. You have to remember back in the 1930s and 40s, it was very ill accepted mental health. They didn't know much about it, didn't know how to treat it. So I never said it to my mother again, even though my grandmother was always in institutions. My mother never really had her home with her. She always was in mental institutions. So that always hurt my heart for her to have that stigma associated with her mother like that. And we have the structural stigmas. That's when your place of employment or other places don't want to deal with people with mental illness. They don't care if they're seeking help or not. Okay. Um, I had one person come into me to my practice, and she was like, I don't know if I want to get on medications though. I accept me having bipolar and everything, but I don't want to get on medication. I'm like, why? She was like, well, I'm in school for one, and if they see my urine, one of those drugs may come up. I'm like, and what's your point? Because it's a bad stigma. They may label me, I don't care. I got your back. I will always write a letter for you, letting them know you're not abusing anything, you're under my treatment. So that is not an excuse. So she did go head on and start her treatment, and she's been very successful in it. And the last one is health practitioner stigma. I'm a huge advocate for mental health, a huge advocate. And you have some mental health or practitioners, period, who do not do their due diligence in helping people with mental illness. They'll prescribe a medication to the person, especially primary care physicians. Now I'm a family nurse practitioner as well as a psych nurse practitioner. And I know a lot of the side of the family or physicians, they'll prescribe medications and they give an 11-month refill, not going back to see or reevaluate them every month, even every month, just to see how they're doing, if they need an adjustment to their meds or whatever. I follow my people every week just to make sure they're not having any adverse reactions or side effects to the medications if I need to increase the dosage. So I monitor them very closely. And then it bothers me that a lot of practitioners do not listen to their patient. I have a lot of people coming to me, I'm telling my practitioner provider I'm having these symptoms, and they're not addressing it. They're not upping my medication. They're not changing. I've been on this medication for 4 years. It's not working anymore, but they're just not believing me. And that irritates me to no end with practitioners or providers. So I know a couple of months ago, we talked about some of the things as to why people do not want to come and get the help that they need. Okay. I talked a little bit today about it, but one of them being a taboo with it, right? A huge taboo, especially within our culture. And I am so pumped because a lot of Black men are coming to my practice. And every time I see them, my heart just overwhelms with joy, because I said, not only the people of color, we don't want to come in, but Black men do not want to get treatment. But they are coming in droves. They're telling their friends. And these are people who are teachers, attorneys, and doctors and stuff like that. And that makes me feel really good that the Black male has come and stepped up and stepped out, knowing, and it's the younger generation. It's not necessarily the older one. I just got a 14-year-old in my practice the other day, and I thought his mother was the one that recommended it, and because she was a social worker, and she was like, no, he told me he needed help, and he wants to get back on medication, and he needed it. So I gave him all type of accolades, because for you to be 14 and knowing that you needed something extra was a huge step, and he was very pleased with everything. So I applaud that gentleman. A lot of people we know have their spiritual belief, and I talked about this before. I've come from a long background of pastors, bishops. I'm a PK, where my mother was my pastor for years. She passed away. And a lot of them tell you, just give it to the Lord, pray about it, go on about your life. I'm like, I need a little bit more than that. But God, I'm not saying nothing about God, because y'all know I truly believe in God, but I truly believe he places people in our pathways to help guide us along journeys. And that's what we're here for. So that spiritual stigma, a lot of people in the religion they look down on mental health help, and then there's that aspect of them calling people with schizophrenia or whatever having demons. We know about that, and just the negative stigmas attached to it. Whatever your beliefs are, we should not inflict it upon anyone else, telling them, oh, you got a bunch of demons in you. Just let's meet them where they are and give them the help that they need. A lot of people in denial, even though you can show them everything in the book, the DSM-5, the Diagnostic Statistical Manual, you can show them everything, how they are diagnosed, every last symptom that they represent. That ain't me. Oh, okay. Well, I don't know what you want me to do about it. So again, they are in much denial. They try to lessen it. When I do my assessments, of course, I do my assessment at the end, but I'm asking all my questions. They don't know what I'm asking. They're just answering. I'm like, I gathered all my information already. And, I do it just like that. And they're like, oh, yeah, okay. But they're in such denial. Then people have lack of support. When they do get the treatment and want to get the help that they want, right? Your family around you or your friends around you, they tend to shun you, don't want to be bothered with you. Go over there somewhere. A lot of people don't have access to transportation, so they can't get the help they need. So just the lack of support is just a sad thing to me. So these people are really wanting the help, but have no support. So again, they internalize all of that, and it stopped making them want to get the medications or the help that they need, stay at home, and just become even more depressed. And then that leads to the shame portion of it. A lot of people are shamed because of the labels. And I try to make my people feel good when I diagnose them. I tell them all the time, I do not diagnose a label or a title. I diagnose your symptoms. I don't care if you have schizophrenia. Everybody that has schizophrenia does not have, they probably had the diagnosis years and years ago, but they're probably only presenting with anxiety right now or whatever. A lot of doctors or providers will just start treating them for the schizophrenia. Why treat them if they don't have those symptoms? Let's treat them for their symptoms only, not their diagnosis, because you as a provider, you're shaming that individual too by not doing your due diligence to help them. Okay. I'm trying to see if a question. All of that and cost, even with insurance. Absolutely. The cost is horrendous. A lot of people have lost their insurances, especially during the pandemic, and they have to choose, just like with your physical health, a lot of people have to choose between if they need their medications or want their medications versus paying for what? Their lights, gas, or food. And we know that has been a huge issue. Absolutely. So right now, especially during the pandemic or with our grief and things such as that, we find that a lot of our symptoms have either increased drastically because we're shut in. We have nowhere to go. We have no one to talk to. Or you're finding that some of your symptoms are new. They're new onset of symptoms. I talked about that, how we're differentiating between the adjustment disorder versus the major depressive disorders. It's all about time frame. So you moved beyond the 6 months adjustment disorder, if you had it for that length of time, into the depressive disorder. So you have having these new symptoms arise. You having an increase of substance use. There are so many people abusing alcohol right now, heroin, crack cocaine, literally. I got a lot of patients on my load right now with that, just an increase because they don't know what else to do right now. And it's a sad situation. And then we have the domestic violence that has increased. Family members stuck at home, and it just doesn't have to be husband on wife, wife on husband, children, domestic violence. Everybody's just getting the brunt of the situation of us being isolated so much. This is a new normal for us, and we do not know how to adjust. And then there's the child abuse and neglect that has increased drastically because we know that the schools are closed right now for the most part. Some schools do the hybrid, but the children are at home. Their safe haven was the school. right? But now they're at home with that abuser or that neglector 24/7, and there's increased cases of abuse and neglect. And then we see the suicide rate has definitely increased. I had a gentleman that I've been seeing since April at my other job, and he lost his job through the pandemic last March, and they haven't called him back. And he's been just getting so much depressed. He's Caucasian, and he said, "Yeah, I want to commit suicide. I'm thinking about it." He said he has no plan, and usually I tell them, "Okay, well, let's do a verbal contract," and they all agree with me, and I see them, more regularly. And he was like, "No, I'm not going to do a verbal contract today." I said, "Okay." So I had to step back for a minute because he was extremely depressed. And we know that the statistics is elderly Caucasian males are more prone to commit suicide. So I had to take a step back and have a talk with him. I said, "You got three options. Either you go self-admit, or I'm going to direct admit, or you can make a verbal contract with me. I'm going to see you on a more frequent basis, like 3 times a week." So he chose the latter, and I still call him even off my job because it's all about that individual. And it broke my heart because he's such a sweet gentleman. And sometimes people, that's all they know. They provide for their families. They don't know what else to do. They don't know what else they have nothing. They believe if they can't care for their family the way that they have been, because again, his unemployment had ran out, so he had no means of income. So it just broke my heart, and I just try to make sure he's okay. And it's not all about keep putting all that medication in them. Sometimes they just need somebody to talk to. And I just implore that people do that for, if you see somebody going through that hard time, to reach out to them. The elderly, they're at home by themselves. A lot of the times they have no one to converse with or to reach out to. A lot of their family members have kicked them to the curb. I mean, even before the pandemic, we know that existed anyway. So just to reach out to your elderly individuals and just to see how they're doing, just to do a mental health check on them. Your friends, like you said, the strongest individuals sometimes are the ones that need to be checked on as well, because it's that mask that they keep on presenting to the public, and inside they torn all up. And I can speak to that for myself. I have to read a book about nothing. I can speak to that. The stronger you are, the more devastated you may become inside, because you're taking everybody's problems onto you, and plus your own problems. So like I tell people, I'm not ashamed to tell people I was diagnosed with the depression and the anxiety. You deal with it how you deal with it. And people always ask, well, have you ever gotten on medications? I have not. That was not what I wanted to do, but I've never been against it. Okay, I tell people, you do what you need to do. And as I look back now, I tell myself maybe I should have wanted to, I probably wouldn't been in the place I was for so long, for like 4 years. So maybe I should have gotten on it. But, again, I had some of that stigma attached to me about 12 years ago when my son died. So I tell people, you do what you need to do, and find one person, even if it's that provider who got your back 110%, call them when you're feeling down or whatever. Let them be your cheerleader, but stay on your medication regimen, your counseling sessions, or whatever you need to do, and just seek the help you need. So that's some of that underbelly as to why people don't deal properly with the grief, that the stigma is for real. And I try to put on everything I can, break that stigma. I mean, we're at an age we need to be doing so much more. And again, I thank my Sisters Keeper for this platform and others, because it is so needed. People need to understand it's not going on anywhere. Mental health is not going anywhere. Okay, it's not. So and it's this newer generation that has accepted it. I'm 46, and it's like around my age and up. Oh, they have a very hard time dealing with it. So what are some of your suggestions or what have you all seen out there as far as why people are not getting the support or the help that they need in regards to mental health, and to help them deal with the grief process or any other mental health issue?
Well, I guess I just remember everything that you say, my friend. Everything. Because and I just wrote them down from the fact that um for depression itself, it's and even mental illness itself being in our family, it's such a stigma where people just shun you
Yeah.
just because you like say it. Um,
Mhm.
Mental illness, like you, it's been on my mom's side of the family where I have multiple
Yeah.
family members who was diagnosed with it. And like you
Yeah.
said, my family members, what they called it was, oh, she had a nervous breakdown.
Breakdown, right? That's what they
That's how
call
they
it.
labeled it, earlier on. That's
Or a
how you
spell,
learn.
or she having a
A
Yes,
spell.
spell.
they
That's it.
called it
Yes.
different things where it was not mental illness, it was a spell or this, and that's how they
Mm-hmm.
recognized it, and they didn't want to call it much more. And
Hmm.
then when you learn otherwise, it was like, oh, okay. And then you felt ashamed
Yeah.
or other people made you feel ashamed. It got to the point where even being a nurse, I it was I don't want to say that I was like I personally knew, but
Hmm.
I I guess I internalized it differently and basically isolated myself because of it and didn't want to seek help initially. And I remember because like you, it was the incident that happened, and I think I shared before where I didn't lose my son physically,
Yeah.
but because of an act that somebody perpetrated on him,
Hmm.
I lost the feeling like I was a mother to him.
Absolutely.
And that caused me to become very depressed. They stole my son's childhood from me.
Yeah.
They stole
Mhm.
what I felt like my ability to protect him, my mothering to him. They stole that from me.
That
And
provider. Yeah.
I laid in my bed, fought in myself. Here was I was going to school to become a nurse, and I felt like while I was trying to fulfill my dream, I put myself
Mm.
into harm's way, and I
Yeah.
fought myself, and it was like it was all my fault, and that's how I felt.
Mhm.
And so for months, I couldn't even get myself out to bed to help myself.
Mhm.
I got him help, but I didn't
Get
help
yourself
myself.
up. Yeah. Hmm.
And um, and then in that process, I lost myself. And then eventually, I kind of like my faculty. She directed me to
Hmm.
the school psych office at my university. And I remember sitting there, and the psychologist said, "Are you trying to tell me all the reasons why you're not depressed?" And she
And
pulled,
that's y'all trying to bargain
she
all the
pointed it
time.
out to me, and that's when I realized exactly what I was doing because I was a nurse. I was skilled at it.
You skilled
I
at it. And
thought
those
that
is
I was skilled
yes,
at it, and I thought somebody else I could have fooled, but I couldn't fool the person who was the
exactly.
master at it. So that's when I had to come to grips with myself, and I said that
Hmm.
with all the mental illness in my family,
Yeah.
if it was just depression, you know.
Yeah.
And another thing that I think that was the issue with me is that because of me being a nurse, I felt that I supposed to be the person who's supposed to help others. I wasn't supposed to be the person that was supposed to need help. So
Absolutely.
that was another thing that was a struggle with me. That I'm
Yeah.
always that person that I feel I'm supposed to help other people, and that's what I devoted my life to. That now I was the one that needed help, so I had to come to a grip with it's okay to not be okay, and
Right.
that's what I tell people. It's okay to take time for yourself. It's okay to not be okay. It's okay to not be a superwoman. It's okay that you need help too. And that's what we have to realize that you matter too.
Absolutely.
And if you don't take care of yourself, then
Can't
you
take
can't
care of no
expect
one else.
right because you're not 100%, you're not whole. And that's some
Yes.
things that we have to realize as women. Like we give all of ourselves to everybody else. And then when there's nothing left for us,
Hmm.
we run on empty.
You're right. And it's funny you said that, and I think I shared a little bit about that. The people with the highest education, they always trying to back their way up out of it. Okay. No, seriously. And that's why I always send out paperwork for them to fill out at least 24 hours before our appointment. I get to know them a little more. And I always look at their educational level because I'm like, okay, here we go. I got to pose these questions a certain way. You know what I'm saying? Because I already know. Because they try to analyze as I'm asking the question, they trying to see where I'm going with it. Just answer yes. It's a yes or no. That's all it is. It ain't no in between. You either feeling depressed and don't want to watch up for a week, or no. I mean, it's so they always trying to analyze the stuff, but then I get them at the end and they have to break down and be like, okay, you got me. I'm like, just answer the question.
And that's why
Okay.
the patients that I get in my office who were me or who don't want
Mhm.
to go there and they say, well, I don't want to do this and I don't, I say, well, you know what? Just go and just talk. Just have a
That's
conversation
it.
first. You know,
Hmm.
I'm not trying to be the psychologist, but if you could just go and get to that point and get
Yeah.
through that, get over the wall first and come around it first,
Come
and then
around
have
it.
that conversation first. And
Yeah.
you will see what, because it's all individualized. What works for
It
me may
is.
not work for you.
You're
You
right.
may need the lamp, the lamp may not work for me. I may need medication, or you know what I'm saying?
Right.
It just depends. Everything is all
That's true.
individualized. Or or Nicole or somebody else might need the lamp, the medication, and a blanket. You know,
And the counselor, okay,
everything
at all, okay, right.
everything
Yeah.
is all individualized. So you don't know what it is that you need. Somebody just need just
A
a
little
listening
more.
ear because they
Hmm.
don't have the support at home. Or like you
Right.
said, it's all about that support. And another thing, where you were saying health practitioner stigma, one of our let me let somebody else in. Another one of the doctors, we were doing something. Oh,
Hmm.
they're all doing some of the diversity things at Metro, and that's one of the things I like about Metro. It is the melting pot, and they're
It
trying to do
is.
more about diversity. So in the OBGYN world, we're doing um, book clubs, and they're doing a lot of books on diversity. And one of
Hmm.
the doctors, she said, you know, I commend us for doing this, but I have one African American lady, and she came to me for one of these issues, and she did not have an issue that I need to address. She had an issue that was about X, Y, and Z, and all she needed was the practitioner to listen to her. She said it
That's
was
it.
not my issue, but I sat down and I addressed it and I called up this doctor, this doctor. It took a little bit more time out of her day, but she listened. And
Yeah.
same thing that happened with me. I had a lady who I don't usually see women over 65. I normally see do more preventative well woman
Yeah.
care, but often sometimes they get on my schedule anyway. And I had this lady who she said that she's been having urinary issues. Nobody would listen to her, so somehow she got on
Mm.
my schedule. I listened to her, and she also said she was doing some bleeding, which was a little bit different for me. And
More. Yeah.
glad I listened to her, and it just so happened that one of the older doctors was there, and I said, you know, I really don't see these patients, but it's concerning me because she's talking about she having some bleeding, and she was
Yeah.
outside the guidelines for PAP, and he said just PAP her anyway. And I'm glad we did that because when I papped her, we saw endometrial cells on that pap, with clues to into maybe she having some endometrial cancer.
Cancer. Yeah.
A little bit
Mm.
too late because eventually she ended up dying. But have somebody listen to her.
Are you serious? The providers are at fault. I'm just being honest.
I,
Sometimes,
I bought her a
you
little bit
know,
of time because we got to her a little bit where she had a little bit long, had a little bit more time with her family. But again, when people don't listen to it, she was complaining of pain, urinary issues, some of these issues that they
it's
just
sad.
didn't listen to her. Again,
Wow.
and that's what I love about case. I'm just because I'm telling you, they taught us, and that's why I always, when you see my subjective, it's always quotes from what the patient says, and I take that time to listen. My appointments take longer because that is so important.
I agree with you.
90% of your diagnosis come from what the patient says.
Says,
That
period.
the physical exam, the diagnosis, the diagnostics, the test, whatever you do, that's only to 10% to
Yeah.
negate or rule in what you were already
What you
thinking,
have.
what they said. it
Yeah.
comes from the patient. They tell you that's them.
They are
They
telling you, they're the patient. I
walking
tell
in.
them, listen to the patient, period. That's why I
Right.
say, forget that diagnosis. What are the symptoms? That's all I'm looking at,
Yes, what's going
period.
on? There
Yeah.
you go, right there. You don't have to be
And
a
sometimes us providers do a bad job at that. We
yes,
do.
listening, listening. All
It's
you have to
called
do is
listening.
listening.
Yeah, I
And
agree.
if you want to just get them out the office, listen, listen. Takes a little bit of time. Just listen.
Just listen. Absolutely. Hi,
Just take
Latanya. I'm
time.
sorry, just telling her hi.
Hi. Thanks for joining us on the link. And another thing that I wanted to bring up too, because this hit home for me as children too, I had to realize that our babies are also suffering
Oh,
in this
yeah.
time. And my son, he said that he was having issues. He was feeling lonely and starting to feel depressed. And he was 11, just turned 12 because of this issue of
Mhm.
remote learning. He's the only child, and well, I'll
Yeah.
take that back. I told a story. He's not an only child.
Right. I know what you mean. That's in
Have
the home.
decade
And
baby.
I know,
So
yeah, I get you. I got a lot of look, 10
my
years
kids are
apart.
2 years apart. So he's the oldie.
Mad too.
My 22-year old and I have a 12-year old, so they are decade babies. So
Hmm.
he's lonely. He don't have one that's his age in a house.
Yeah.
So um oh, I just realized I'm not sure you're white, but that's what a lot. We have to consider all those things.
Yeah. I check in with my children too. I give them a little brief. They listen to me because I work from home sometimes, and I go to my practice. They hear me all the time asking the questions to my patients. And they'll ask me, well, what does this mean? Or what does that mean? Or whatever. But I ask them the questions too, because you got to do the mental health check on your children too. Absolutely.
Hmm.
Nicole, I wanted to go back to it was a couple things you said that were very important that I think we should emphasize here. Um, the first one is you talked about the various types of help that people seek. Like, some people, and of course, this goes without even debate. We do have stigmas in the African American community. And I'll
Mhm.
even go as far as to say everyone we see are at some various stage of mental breakdown, right? We
Yeah.
have everything from anxiety to depression, which is triggered from PTSD and all these other things. And these are common phrases that we hear a little bit,
Hmm.
they're becoming a little bit more common, but we probably don't even recognize all of the symptoms of each one of these types of
Yeah.
diagnoses. Like, we know people that might be bipolar, and they exhibit a
Yeah.
lot of bipolar um, types of symptoms, but then because they may be at a various stage in that particular emotional breakdown, a lot of people won't recognize it for what it is. And we're so quick to write people off because
Hmm.
someone is at a volatile state mentally.
Yeah.
And what is happening now is we're looking at everyone, and everywhere I go, and I say this to people all the time. I'm like, oh my God, I have anxiety. I have social anxiety now. I have social anxiety because I think all of the situations that we've dealt with over the past year, you interact with people, you have no idea where they are mentally. You
True.
know what I mean? You have no idea. I mean, these are people that you
Hmm.
might know, but you haven't seen them in a long time. I went to one of my clinics in Medina, and I swear everybody was being racist to me. But I thought about it and I said, it's
Uh-huh.
probably just my social anxiety because we're we're taking in so much stuff, right? But what you said was so key because what we have to understand is that some of us are at that degree where we need professional help. It's not enough for you to be
Absolutely.
just call your girlfriend or even talk to your pastor at some point because you know
Yeah.
I get a lot of spiritual counseling, but that's not always necessarily, if I counsel with men, they have no idea what I'm talking about. As a
Right.
woman,
I hear you.
as a
Yep.
mother, they have no idea about that type of stuff. They can speak to things that they have experienced, but the word of God tells us that people perish because of lack of knowledge.
That's
We
it.
don't know as much about stuff as we think we do. And Lavada, you said something very important, that at the end of the day, if we learn how to just be quiet and listen, you
Come on
know,
now.
we learn so much more about what's really truly going on with a person, because this the statement that says seeks to understand more than to be understood. We're so
Mm-hmm.
busy trying to think of our response and preparing our response to something someone says so we can convince them and ourselves, okay, yeah, I'm okay. And
Yeah,
another thing you guys said that's important is sometimes it's okay to not be okay,
it
but
is.
don't get upset with that girlfriend or your spouse or a member of your family because you tried to sit down and have a conversation with them about something and they just
Mm-hmm.
didn't give you the comfort that you felt like. Some conversations, some certain when you get to certain points, you do need professional help, and
Absolutely.
and we just got to get there. We just got to get to the point where we're understanding everything isn't for every situation,
True.
and the more we learn, the more we understand, not even just about other people, we got to understand ourselves, right?
That's it.
I have to understand, oh yeah, I have anxiety. Yeah, sometimes, some days I suffer with depression. Some days I'm a little manic. You know what I'm
Yeah.
saying? And then when you have those moments, certain people call your phone, you be like, oh, can because they trigger you.
Yeah. I
And it's
know. Look.
true. We
True.
we are being triggered left and right. There are things that we're seeing and there are things that we're hearing that are triggering us emotionally, and we don't understand what's happening to us. And we don't
Yeah.
understand what's happening to other people. And we have shut this person off, or we have written this person off, and we have cut these people off. I hear that so much, it makes me
Yeah.
sick. I'm cutting this person off, and it's like, you know, maybe they were just having a bad day, or maybe whatever they're going through has nothing to do with you, right? Maybe
Thank
there's
you.
really truly something going on there.
That
So
part. All that part.
yep,
Right.
yeah, so I,
True.
I just wanted to add that.
I love it. And that's all true right there. Yes. Crystal, Latanya, you have anything to add? I
Hey.
think a lot of people forgot it was Super Bowl Sunday because I did too.
Me, I
Oh
did
yeah.
too. I did.
I was like, oh, I said,
Obviously,
but I was
obviously.
like, nope, this is my ministry, so I'm gonna do what I got to do
Right.
still.
And the Browns not there, so it's really not
That's
a
what I
big
said.
deal
I
to
didn't
play. We
wait to
could
see
go
them
back to
either.
halftime. Right.
Yes.
Hi, Latanya. So good to see you.
Yes.
Yeah, how are you?
Hi.
Good.
Um, I guess you ladies pretty much hit everything on the, right on the head. I joined this particular meeting because as on the 9th, Tuesday will be the third anniversary of my late boyfriend's passing. And I know for me after it, because I was with him when it happened, so it was like several layers of trauma and then several layers of grief that came after, because not only was it the loss of the physical person and some things I found out after the fact too. So it was a loss of the person and what I thought for all these years that we were together was, and then to find out some other things that had come up. So then it was a loss of a trust, a loss of, so it's almost like I lost the person, I lost the relationship that I thought there was. And so the combination of those things pretty much had me, I felt insane at one point because I was going between the regular, outside of the regular anger that comes with grieving and the death of somebody, It was that, and then it was hurt, and then having hurt that to someone from someone that you couldn't express it to because they're gone. So I couldn't even, let that person know how I was feeling about that. But then it swung right back around because I loved them. So it was so much, and I was holding all of that in my head because the second half of that I didn't tell anybody for a while after. They just really thought I was just dealing with the grief of his passing.
Mm-hmm.
And then, like you were saying, there would come a point where there was some where guilt. And the reason I said that because he had congestive heart failure. He had been in and out of the hospital for, I think that September before he passed was when he's had it for several years, but that September before he passed was the first time in a long time that he had to be hospitalized in relation to that. So there were a couple of times he had gone in, and for me the guilt was that Tuesday before he passed, we went to his cardiologist. I went with him to all his appointments, and he was given on Christmas. Okay, I'm flopping all over the place. So Christmas he went in, he couldn't breathe, which was part of it. Having a hard time breathing. He would fall asleep almost at any given time because he couldn't get any good rest. So we went into the hospital. He went into the hospital with a blood clot that he had in his lungs. They kept him for several days and sent him home. He had to wear a life vest. And I felt like there was more I could do. He was stubborn. He would not wear that life vest. He wore it home because they wouldn't release him unless he had it on. So I had guilt with that. Just like, and then his doctor's like, you can't make a grown man do anything. You can encourage, but you can't make him do anything. Mm-hmm. And then the night he passed away, about 7:32 actually that morning of the 9th. The day before I was at work late. I didn't get home until about 12:30 because I was working on, we had our sponsor, they do 3 times a year, they come out and not an audit, but they come and check all over our books because I work for a school. Making sure that our compliance visit. So I was at the school that night working on compliance. And got home, he was already asleep, he was fine, and how it happened, he literally fell out of bed, pretty much. So it and part of it, I was angry at my job, so going back to work is like, I spent the last night that he was alive working, so that when you spoke about some of the guilt you felt with your son passing and that you were working on, which you were working on for yourself, and what that happened, I understood and I felt that because like I take pride in my job. I don't get paid overtime because I'm salaried, but there was a job that had to be done. There was something that needed to be done, and I was going to make sure it was done and complete so that it would be ready for the next day. So getting back to work, it was all these things. And I'm one of those people that have a hard time sharing or letting people know that I'm going through something. So like I said, people understood the grieving part, but they didn't understand all of these other issues and anger. And like I said, I actually felt insane. And it did take a while. It took about 2 months for me to decide I have to go talk to somebody. I have to. And I did eventually go to a counselor because I was like, I can't keep this in my head any longer. I would talk to different people about different parts of it, but there was no one person. And part of it was, for me, shame too. So it was easy to talk about the physical loss, but it was embarrassing to talk about the other stuff I found out that he was doing after he passed. So to find someone to talk about, some of those things too, is like, I'm embarrassed to bring this part out, so I'm still not getting it all out. And even after that, like I told my mom, she's very supportive, and there were some things I didn't tell her until later because I also didn't want to make him look bad to other people. Other people that have brought him, like in my family that had taken him in, have been there for him, through this time. And it's like, okay, so now it's like talking bad about someone that had passed, and I didn't want them to look bad in their eyes. At the same time, with dealing with his mom and getting the things from the house cleared out, and it was just so much. It was just so much, and so overwhelming. And I think a lot of those things, part of it, on top of the stigma, is, like I said, some of it was shame. I felt like, okay, just how stupid were you that you didn't even catch on to some of this? I was like, I felt at that time, I probably would have dealt better if it was one thing or the other. Like if you're still here and I found out some of this stuff, okay, I could cut you loose, I found, okay, and move on. So for me, that's my story. That's what was extremely, 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 extremely hard. Is getting to the point where I recognize I'm about to lose my freaking mind.
Yeah.
I cannot, days where I couldn't breathe. And it wasn't until after I did go to her, it was twice a week for about 3 months, that during that whole time, from the time he passed when I started going, it's like I realized I hadn't taken a full breath. Like as I was able to talk, it's like, I don't know how to explain it. It's like, so all
no,
the time,
you're right.
It's like I couldn't breathe. I couldn't breathe. There were days I physically really just almost couldn't breathe. But that's my story.
Nicole,
with
can I
that.
make one comment? Can I make one comment before you, because I know there's a lot for you to unpack, but one comment that I want to make about death that I think is so hard for us to wrap our heads around is that we are appointed a time to be born, and we are appointed a time to die. Yeah. We don't get to make any decisions about how we die.
Yeah.
We don't get to make any decisions about when we die, because there are people who can attempt to take their own lives. And if it ain't their time to go, they're here.
And go. That's it.
And I don't know if anyone has ever, and I'm sure you guys as medical professionals have dealt with people. And when they use the phrase transitioning, there's certain parts of transitioning out of this life that we don't understand physically, because when the person gets to a certain point, it's just between them and God, Yeah. And I remember when we lost our dad, and he had been sick a long, long, long time. And it was things about transitioning that I didn't understand, because hospice gave us a book to read, and we, of course, didn't read it because we didn't think anything about it. But you read it after the fact, and you start connecting the dots about the changes that are happening. And there's so much guilt when a person, that you love, and you can't care for them the way that you feel like you want to care for them. So we had a lot of guilt too, because he was in a nursing home when he passed. And I think we all grieved that portion of guilt, to say, man, maybe we could have done something differently. Maybe he would have been here. And it took us years, I know for me, to understand it was his time to go.
Yeah.
And that was it. And and there was nothing that we could have done differently that would have changed that date. True. That date was coming. Amen. I think that's the most humbling thing about how precious this life is and how difficult it is. And we know people who have taken their lives. We know people who have died suddenly oh my God, they weren't sick and all of a sudden they died. And but that's really because there is an appointed time for us to
Amen.
leave, and there's nothing, that we can do about it but live this life differently, right? Because we know that,
Yeah.
and people say to people all the time, when people lose a family member, and they'll say, you know, you hear that saying, oh, life is short, embrace life. And we're like, oh yeah, send prayers and condolences. And we think nothing about it, as if the people that we love today are always going to be here.
Yeah.
Mhm.
They're not. They're not. I just picked up Bishop Curry's book, and he quoted a quote on there, and he said, at the end of life, we realize that all memories were precious.
Amen.
Everything, all memories are precious.
Yes, they are.
And I get what Tanya's saying. It's so true, because you start, if you were home and you didn't have to work, it wasn't going to change the outcome, because that was the time that God said, come home. There's nothing we can do about that. But we struggle through this life.
You're stuck. It always catches us with our mouth wide open too. I don't know
Don't
why it does. When I'm like, really? Well, while she's
it?
pausing for a minute, but thank you, Tanya, Latanya, for sharing that, because I definitely understand what you're saying as well. I just celebration of life for my son who passed away on February the 1st in 2009. So it was 12 years for me. And you never get over that, but I've learned to deal with it. And I had a good day. But now I'm still processing the grief of my parents. My father died August of last year, my mother the year prior. They both lived with me, and I'm still processing it. Both, took care of them, was working, had children, have a husband, and I felt that I wasn't getting the help I needed, and if I could have did this, if I would have stopped this job, maybe, but they both died in my presence. Well, my mother, I knew she was dying that day, but I had to do something. I said, Mama, I know you're going to die before I leave, before I come back home. And I told her everything I needed to tell her. And, but I was right around the corner. And it was just like my mother. She knew they said I didn't have to take something over if I would have waited till 2:00, and she died at 1:55. But I came home right then and checked her, and she was gone. So she was in rehab for 2.5 months. I put her there because she was just going down congestive heart failure as a beast.
Mhm.
And she just wanted to come home. My father and her been married for 65 years, and she was always worried about my father. He had Parkinsonism with Lewy bodies dementia, bedridden, couldn't do anything. So she was always thinking about him. So I was like, Mom, I'm about to bring you home. It was Saturday, and she died that Monday. I knew she was leaving. She knew she was leaving, but I understand that guilt, and then some family members try to put the blame on you even more. So I'm like, y'all ain't do nothing. So it's just a hard thing, and I'm still dealing with it. And her birthday was January 28th, had a rough day that day, very bad day. But, you know, and I tell people, even though I'm a provider, I provide counseling and all that stuff, I still see people for my own mental health cleansing, because I can't help people, as Lovato was saying, if I need extra help myself. So I have to make sure I'm in order to help others too. Yeah. And Latoya, and it's very common what you said also, Latoya, you said that you wasn't sharing everything with your counselor or therapist, and you wasn't getting that full healing. That's very common. I have people I counsel a month later. Oh, I forgot to tell you this part. No, you didn't forget to tell me. You just wasn't ready to tell me. And it's okay.
Right.
It's okay. You have to get comfortable with me.
Hey,
But
yo, all
yeah,
the time.
it always happens like that.
And
Whenever
it's funny,
you're feeling
you
more,
know what?
huh?
Because my counselor pretty much said the same thing. She was like, I
Yeah.
could always tell that you were holding something back
Yeah.
until it finally, like milling out a little bit here and a little bit
Yeah.
there. And until by the time um by the time it ran its course, because she said, I mean, as long as you need to come,
Yeah.
you know.
Mm-hmm.
Um, and when I got to the point where I could actually come into our office, it's like, this is a great place. I mean, where the trepidation started to,
Yeah.
I looked forward to my sessions. It was cleansing in a lot of ways because I realized there was a whole lot of other things that went into how I was dealing with my grief too.
Yeah.
That was outside of just specific items, different backstories that led into some of that. But yeah, she said the same thing. She's like, as I would start disclosing a little more and a little more as sessions went along, as opposed to just putting it all out there initially,
Yeah.
she was like, you could tell you were holding on to something.
Absolutely. Yeah, we know, but I mean, we're not going to push you. You do it at your time, and that's what a good counselor does. Give you the limelight. It's not about us. It's about your healing journey, and when you're comfortable to relay that to us. Yeah.
And another thing that I was gonna say, Latanya, what you were talking about, which just breaks my heart is that women, and I think this like goes on to our mental health. What we hold in is so much baggage. We just pack so much baggage onto ourselves, shame, guilt. So, and we just pack it and hold it in and hold it, and it ends up weighing us down and affecting us so much mentally. Like you said that you felt ashamed. So here it was, you were already grieving initially, feeling alone. And here it was, you were cycling between grief and shame and all these things till you were making yourself insane. And you felt shame for what? For trusting somebody, loving somebody? You did nothing. You're a beautiful woman who you were vulnerable. You gave your love to someone who you were, and you did nothing wrong. Why should you feel shame of somebody who took advantage of that? He should have been the one who felt who was who should have been who should have been feeling ashamed, but he wasn't. So why should you have been feeling ashamed? And that's what I don't get, why we take that on and carry that baggage and make that part of us. Like it's one thing if you keep going back, but you didn't know. This what you found out afterwards. So why should you have felt ashamed when you didn't know? So not only did you have to deal with the loss and the grieving that process, but you were dealing with shame, something that you should not even have to own, and packing that baggage in as well.
Yeah. And that was interrupting that grief process. So absolutely agreed with that. I thank you for sharing that, Latanya, because a lot of people wouldn't even share that.
Hmm.
It's so much with grief, it's a multifaceted thing. It's
Yes.
not just one dimensional. It was a loss of a relationship you thought you had. And I tell people, grief is a loss of whatever, not just death, loss of a relationship, loss of a house, loss of a job. It's a loss that was something huge to you in your life. So yeah,
And that's why I even say my son, because, like I said, for me, even though he wasn't physically lost, it was still a loss for me, in
that
that
is.
his
Yeah.
it was a loss of his what I want to say, his
Innocence was
innocence,
lost.
right?
Absolutely.
And
Yeah.
also what I felt that my mothering to him that was lost.
Yeah.
So yes, it doesn't have to be something physical. It could still be.
Any type of loss.
Mm-hmm.
Yep.
And for
Yep.
women who and a lot of people, since I work in women's health and I'm a midwife, it could even be for a woman who is carrying a baby, and we have to tell her baby is going to have Down syndrome,
Yeah.
or it's not going to be a normal baby. It could be the loss of what you thought was going
That
to
a
be
dream. Absolutely, for your
right.
child. Yeah.
for some of my ladies, it's like I have to say, well, we're gonna have a healthy baby because that's what I had to come to grips with. I wanted a girl, but I had to find out I was having a boy, another
That's
boy.
all right.
But
Having a
it was
healthy baby.
okay. I had to go from mm, getting my purple stuff, picking
Purple
up
stuff.
other colors.
Yeah.
So yeah,
Yeah. And I think that's it. I mean, unless you all have anything else, I think it was a great session as always.
that's a wonderful session.
Hmm.
Like you said, as always, I can't
As
wait.
always.
Yes.
And you all can always let me know what topics you want to talk about as well. I try to be well versed in things. So, I don't want to always, this is what we're going to talk about today. You can just shoot me something or shoot it to Lavada and we'll come up with it and keep it moving, you know.
Yes, yes. We we could also dealt with grief of we didn't go to the to the Super
The
Bowl.
playoff, man, look, my whole heart was broke, but that's all right. I was happy with my Browns. They did great
Right,
this
they
season.
did. At least we set the Pittsburgh home first. As far as
I
I'm
know.
concerned,
So
that
I was
was
like, bye.
my Super Bowl.
I agree with that.
So I was very happy with that. We sent Ben and Juju home first.
Yeah, Big
but,
Ben, right.
but
All
thank you
right.
for joining us again. As I said, I'm so excited that we're going to be doing this once a month starting in March on Wednesdays. And as always, thank you for your support from my sister Keeper Cleveland, my sister circle support group. Look forward to have you on later this month. We already have the topic. We're going to be talking about herbs and how they can help heal us. So that's already posted. Go on and register and join us. See you next
Okay.
time. Thank you.
All right. Bye bye, everyone. Have a great night. Bye bye.
Yeah.